The Winter ECG pattern consists of an ST segment upsloping depression of 1 to 3 mm in precordial leads associated with tall, peaked T waves. The Winter T waves pattern is indicative of acute LAD occlusion, which warrants primary PCI. If the Winter ECG pattern is observed, it should be treated as STEMI. Immediate cathlab activation or immediate consultation with a cardiologist is indicated.
De Winter T waves are an ECG pattern seen in acute occlusion of the proximal left anterior descending artery and are considered a STEMI equivalent, despite lacking classic ST segment elevation. The pattern is characterized by upsloping ST segment depression at the J point in the precordial leads, followed by tall, symmetrical T waves, often with subtle ST elevation in lead AVR. Recognizing this pattern is critical, as it indicates a need for urgent reperfusion therapy, just like traditional STEMI.